This is a 41-year-old woman who, as you can see, has quite droopy breasts. So we're going to do a breast lift today to lift her up. She also has very wide areolas, so we're going to bring those down. And we are going to reduce in size the right side, her right, your left, in order to match them better with the other side. So let's head into the operating room and I'll show you how things look there. Okay, here are her markings for the breast lift. As you can see, she's got very, very wide areolas that even the coverings won't cover all of them. We're going to move them up, the nipples up higher, and we're going to reduce the size of the areolas. This is all the skin that we're going to take off on each side. Her right's a little bit bigger, so I'm going to take a little more off on this side than that side. And I'll show you how she looks when we are all done. Okay, we're all done. Everything went real well, and you can see it's a big change in how she looks. I think she's going to be real happy. There's a little scar that goes around the areola down and underneath. You can see little drains. Those will come out in 2 days, and we'll show you how she looks hopefully within the next few weeks. All right, we are now 3.5 months out of her surgery, and she is healing really, really well. Let me just show you her scars. She does have a scar that goes around the areola down and underneath, and it's healing very, very nicely. Her shape is really good. And one thing we really wanted to do is we wanted to get good symmetry with her. And so she definitely looks very symmetric one side to the other. Now that she's 3.5 months, she can do anything that she wants. So her activity is back to completely normal. So a couple of keys with breast lifts. This patient was African American, so she has darker skin. Because of that, she is at a higher risk of a darker and a thicker scar, and even keloids with this operation. So this is something that I spent a lot of time talking with her about prior to surgery. If you're thinking about a breast lift, a couple of key points to make. Number one, there's no such thing as a scarless breast lift, and so it's a trade-off. You're trading breasts that are droopy for breasts that are lifted, have a nicer shape, but have scars. Scars never disappear, they are permanent. And then for those of you wondering, do I need implants if I have a breast lift? You only need implants if you have a breast lift if you want to go larger. If you don't want your breasts any bigger, then there's no point in using implants.